Here at George Washington University, students have been taking their classes online since March of 2020 because of the pandemic. For these students, this has been an especially isolating year in what should have been one of the most social years of their lives. I've talked to a few of the students who've had varying degrees of isolation and adjustment to their new normal. Vanshika is a junior at GWU and lives on campus now, but spent the last semester at home.
Last semester I wasn't on campus at all, so that was really difficult. I didn't get to see any of my friends. It was really hard to maintain friendships over text and call and stuff, so that was just not great.
Many students at GW have found ways to make online classes work, but extreme cases exist across the country. In the medical community, many are seeing the negative effects to overall mental health. To Dr. Marie Hassan, a psychiatrist and medical director of psychiatric hospitals in New Jersey, the pandemic has increased the levels of stress and isolation that college students experience to some higher extents. Normally, at inpatient units where the patients are not allowed to leave, college students are a rare sight, but the pandemic has shifted this.
Unusually, recently, in the last year and a half especially, we've gotten a lot of college students from our local university who wouldn't normally have been admitted. I do believe it's from the pandemic. The isolation has been tremendously stressful, especially for young adults first leaving home. So it's concerning.
But there is hope in the way that the pandemic is encouraging innovation toward new technology, like telepsych, in which psychiatrists can talk to the patients who have access to technology from home.
There's going to be more things available, like some of the apps that you can use now to screen for depression or to rate your mood. There's so many wonderful things available, that people who are tech savvy can access. So I think there'll probably be more people getting help, which is wonderful. The problem is people who are not tech savvy or don't have access, they're going to be much more limited. I think with the next generation, though, that barrier will be a lot easier to surpass.
New ways of getting care online can bridge gaps for those who cannot get to a doctor's or therapist's office. And these benefits could be seen at universities too, where accessibility to services like counseling is a necessity.
Students, I think college students tend to be facing a lot of difficult problems with separation and individuation as it is. So with the pandemic, I think the isolation just enhances that. But with telepsychiatry, perhaps we can give them more access to counseling. If the universities can meet that challenge, I hope.
Even for the students who are well adjusted to online learning, like Anna, a junior who is living off campus in DC, the feeling of personal connections is still missing.
It's hard to do well in a class when you can't connect with your classmates because it's so hard to do that virtually. You can't really go get like a coffee with someone after class if you've had a good conversation with them. A lot of the Zoom relationships feel more artificial. It definitely stinks, especially if you know a friend is having a hard time and you can't really get to them except through FaceTime.
The pandemic could be turning the corner toward a brighter next few months as COVID cases decrease and vaccination rates increase. Many students hope to have a normal next year of in-person classes and social opportunities. Even so, how the mental health of young adults into the future will be affected by the pandemic remains to be seen. Reporting from George Washington University in Washington, D.C., this is Willow Hassan.